Bridgemark has over a 38-year history as a substance abuse treatment provider in the state of Rhode Island. Bridgemark was first established in 1975 by a group of concerned citizens who believed those suffering from the disease of alcoholism and chemical dependencies could and should be helped. As the field of substance abuse and addictions counseling developed, Bridgemark also developed and expanded. In 1975, Bridgemark incorporated as a 501c3 and became licensed by the Rhode Island Department of Mental Health and Hospitals. Bridgemark soon expanded its programming to include women and children through the development of our outpatient department. Currently, Bridgemark, licensed as a behavioral health care facility by the Department of Behavioral Health, Developmental Disabilities, and Hospitals. Our mission is to provide a comprehensive behavioral health care recovery program. Bridgemark is geographically located in the center of the state at 2020 Elmwood Avenue, Warwick, Rhode Island, 02888. We're on a bus line and we have easy access to and from the highway. Our services are not limited by geographic boundaries. Everyone from everywhere is welcome. Bridgemark is opened weekdays, weeknights, and on Saturdays. We are able to offer customized scheduling outside of our normal business hours or at alternative locations for people with unique scheduling and/or privacy needs. We offer all clients an outpatient appointment for treatment services within 7 business days. Same-day intakes into the outpatient and intensive outpatient programs are available. Call us at 401-781-2700 for an appointment. Bridgemark treatment programs include, but are not limited to, addiction recovery services, family violence intervention services, mental health services, problem gambling treatment, and deaf services. The goal of the Addiction Recovery Services programs is to prevent, intervene, and treat substance abuse and addiction disorders. Bridgemark is non-medical. We utilize behavioral interventions that have been proven by research to be effective in treating substance use disorders. Bridgemark's substance abuse outpatient program provides an array of services that include but are not limited to individual, group, and family counseling, as well as substance abuse education. Services are available for men, women, and children who are experiencing problems with substance use or are troubled by someone else's substance use. Most insurances are accepted. We have a limited amount of state-funded substance abuse outpatient treatment slots available for Rhode Island residents. We also offer competitive self-pay rates. Bridgemark developed the Intensive Outpatient Program, IOP, to meet the ever-growing need for structured treatment in an environment of decreasing availability of residential treatment beds. The intensive outpatient program offers clients the ability to experience a structured and safe treatment setting to begin or to continue their recovery. The program is ideal for adult men and women awaiting for residential treatment, completing an inpatient program, and/or for those who need a period of intensive structured therapy to establish an individualized plan of recovery. Day or evening programs are available to accommodate clients' scheduling needs. Men who are enrolled in Bridgemark's IOP have priority placement into Bridgemark's residential program if necessary, subject to bed availability. Most insurances are accepted. Limited state funding is available for Rhode Island residents. We offer competitive self-pay program rates. The Bridgemark residential program is designed to provide evidence-based, state-of-the-art chemical dependency treatment in a residential treatment program. A unique feature of this program is that it allows men to continue to work or to look for work while receiving treatment in a residential setting. Our program provides adult men individualized lengths of stay. We believe in creating a nurturing and supportive environment designed to help the client help himself to achieve independence in a drug-free lifestyle. The program is non-medical and is limited to men who are medically and psychiatrically stable upon admission. Bridgemark's treatment modality is geared to relapse prevention through empowerment of the client who carries the responsibility for his own recovery. Bridgemark recognizes the important influence of the family in recovery from substance abuse disorders. We want to assist families to recover from the effects of their loved one's substance use, whether or not their loved one recovers or gets into treatment. Family services include family education groups, individual sessions, and family sessions. We propose to engage the whole family system to address interpersonal communication, codependency, conflict resolution, parenting issues, and family reunification or separation. Family members are welcome to participate in these services whether their loved one is enrolled in our program or not. Call 401-781-2700 to begin. The Family Intervention Program also includes substance abuse treatment services for adolescents. Bridgemark recognizes that the multiple problems facing substance-abusing adolescents require a full range of comprehensive integrative services. We work collaboratively with families, schools, the juvenile justice system, child welfare systems, and other community resources to intervene and treat the adolescent substance use disorder. We incorporate a family-centered approach to the treatment of adolescents that is culturally sensitive. Bridgemark's SAP program evaluates employees who have violated a United States Department of Transportation drug and/or alcohol regulation, and makes recommendations concerning education, treatment, follow-up, drug testing, and aftercare for that employee. All of the treatment providers in this program are DOT certified SAP professionals. Staff are also available to employers for training and consultation regarding the issues of substance abuse in the workforce. Bridgemark has developed a multifaceted approach to family violence intervention in response to the demands of our clients and the overwhelming research regarding the relationship between violent crime and substance use. Our mission is to actively utilize the latest research, theories of change, and technologies in the prevention of violence. Services include battery intervention programs, anger management programs, and victim services. We're one of the few Batteries Intervention Program providers that is certified by the Batteries Intervention Program Standards Oversight Committee, and one of the fewer programs that provide Batteries Intervention programs for women who have been arrested for domestic violence. Participants must be referred by the Department of Probation or through judicial adult diversion programs. Bridgemark staff is certified by the Rhode Island Attorney General's Domestic Violence Unit, Batterers Oversight Committee to provide batterers intervention programming. Bridgemark's anger management services are designed to assist men, women, and children who are experiencing problems coping with anger. Relaxation techniques, cognitive restructuring, problem-solving techniques, communication skills, humor, and assertiveness training are among the anger management strategies that participants will develop to help them to express anger effectively. All services begin with an assessment. Bridgemark provides limited services to clients who are victims of domestic violence through individual counseling, safety planning, and referral to Rhode Island Coalition Against Domestic Violence agency programs or shelter services as needed. Victim services are gender specific. Call 401-781-2700 to access any of our family violence intervention programs. Bridgemark offers non-medical mental health individual counseling services and mental health group counseling services. Mental health services are provided by a licensed clinical social worker. Services may also be provided by other mental health professionals under the supervision of the LICSW. Services are delivered in the outpatient program for men, women, adolescents, and children. Most insurances are accepted. Bridgemark has implemented a comprehensive outpatient treatment program for problem gamblers and their families. The goals of the program are to assess the severity of gambling problems and evaluate the consequences of gambling behavior, to provide a comprehensive individual, multi-level, seamlessly integrated treatment program geared primarily towards addressing gambling problems, but prepared to deal with coexisting conditions. We want to help our clients develop a comprehensive relapse prevention plan. Call 401-781-2700 to meet with a nationally certified gambling counselor. Bridgemark Treatment Centers has a licensed chemical dependency counselor who is deaf herself to provide treatment in the deaf client's native languages. We also have a licensed sign language interpreter on staff, allowing all clinical staff to appropriately treat members of the deaf community. All of our programs are available to the deaf community. Please contact our Deaf Services Coordinator through video phone at 401-354-7640. Bridgemark also has the capacity to provide all of our services to the Spanish-speaking community. All of Bridgemark's services begin with an assessment. Simply call 781-2700 during our business hours, Monday through Thursdays, 9 a.m. to 9 p.m., and Fridays, 9 to 5 p.m., to schedule an appointment. As time goes on, research informs us more and more about what works for people in recovery for substance use disorders and behavioral health issues. We expect that Bridgemark's programs will continue to evolve as the needs of our clients evolve. We are committed to developing effective programs that are evidence-based, affordable, and easy to access. We are happy to come out to your program and talk with you and your staff and your clients about our services. Check in with our website or call us at 781-2700.